How much do you know about psychopharmacology, the scientific study of how drugs affect the mind and behavior? Listen along to discover potential pathways and reasons to add psychopharmacology to your psychology toolbox. Hello there, this is Bradley, and you're listening to Psych Everywhere, a podcast by PsychI, the International Honor Society in Psychology. For this show, distinguished guests weigh in on applying psychological science to a diverse range of current events and to better your life. Listen for free wherever you go for podcasts, or see the link in the show note for a written transcript of this episode. This episode was made possible through a PsychI sponsorship with the Alliant International University, California School of Professional Psychology. If you'd like to learn about graduate programs at CSPP, be sure to check out the link in the show notes for this episode. For this episode, I'm speaking with Dr. George Kapalka to discuss potential avenues and reasons why students should consider expanding their psychological toolbox through psychopharmacology. Dr. Kapalka is a program director for CSPP's Clinical Psychopharmacology program, and he's a prescribing psychologist based at the Children's Treatment Center at Albuquerque, New Mexico. He holds a PhD in clinical psych and an MS in clinical psychopharmacology. An avid writer and researcher, he's also authored multiple books, from Parenting Your Out-of-Control Child to Pediatricians and Pharmacologically Trained Psychologists, A Practitioner's Guide to Collaborative Treatment. Dr. Kapalka, welcome to Psych Everywhere.
Thank you for having me. I'm looking forward to this conversation.
Absolutely. So, what inspired you to advocate for integrating psychopharmacology into the psychological toolbox, and how has that kind of evolved?
When I first became a practicing psychologist some decades back, I originally had actually very little training in psychopharmacology, but having a standard practice, which I think probably was typical for most practitioners out there. My practice primarily was with kids and adolescents. That's always been my primary area of interest. And I became struck by the proportion of my patients and clients, which were actually on medications, while at the same time, they came in to see me for psychological treatment. So that really sparked an interest on my part in understanding, on what are these medications used for, and how can these medications help a person with a variety of symptoms that they may be having. And more specifically, too, as a psychologist, what are some ways in which I can best work with someone who is also on psychotropic medications? So that then led me to gradually obtain more and more training, initially through continuing education classes to learn more about medications, medication categories, the most common medications that are prescribed. As I went into that area more and started to obtain more training, I started to kind of feel more confident in thinking that perhaps if I get some additional training over and above my psychologist training, now specifically in psychopharmacology, maybe I can actually have a role in discussing medical psychopharmacological treatments with the prescribers, so that I started gradually to consult more with psychiatrists and even more so with pediatricians who are prescribing some of these medications. And then over the years, having worked and that by now a lot more in psychopharmacology, I decided to go rest of the way and completed the Master of Science in Clinical Psychopharmacology and the practical experiences that are done afterwards. And then I became a prescribing psychologist in New Mexico.
In your view, what are the most common misconceptions about psychopharmacology, and how might training help to dispel those?
So working with kids and adolescents, especially, I find that not everyone, but a large proportion of families, especially family members, mothers, fathers, and with teenagers, maybe patients themselves, have sort of a polarized view about medications. Some feel the medications are kind of like a godsend and will fix all their problems very, very quickly and easily. And then others kind of go the other way and have this intense fear of medications and feel that just about every psychotropic medication is going to do something bad, something unwanted, will have side effects, will in some way make them feel worse, right? And the truth, of course, is somewhere in between, that these medications can be helpful for a lot of people. Not for everybody. These medications address a lot of symptoms, but not all of them. There's more than enough room for psychologists to continue to deliver their services, even though medications are kind of helping along the way. So I think a major task of a practitioner who either is a prescriber like myself or just works in a mental health capacity of some sort, as a psychologist, mental health counselor, works with patients and clients who are on medications, is to kind of understand that, you know, medications play a role, but they play a limited role. They can be beneficial. They can also have side effects. And then be able to work with patients and clients with this more objective approach towards psychopharmacology to kind of help them understand what role psychopharmacological treatment can potentially have in their treatment and the improvement of their symptoms.
What should students expect to learn while pursuing training in psychopharmacology?
I think the best way to look at obtaining a background in psychopharmacology is to kind of look at it at three levels. So I think the first level would be appropriate doing undergraduate studies, helping to understand how psychoactive substances in general can affect a person, and that might include medications that are prescribed, but also psychoactive substances that people tend to use that are available over the counter, like supplements that are available, you know, and part of usual lifestyle, like drinking coffee, for example, what caffeine does. Some recreational substances have become more popular over the last few decades. For example, cannabis and how that affects a person. Of course, a number of people consume at least some amount of alcohol. So I think the first level is to gain a better understanding during your undergraduate studies of how psychoactive substances in general affect a person, their moods, and how they may affect a person's behavior, decision-making, and so forth. And I think the next level would be doing graduate studies where students who are planning to become a mental health professional, a practicing psychologist, can really expand their knowledge of what affects a person and all the factors that influence feelings and behaviors when a significant psychopharmacological piece is added to that. So a good example is what we do at Alliant in our Master of Science in Clinical Psychopharmacology. We accept students at the doctoral level who are at least halfway through their studies, give or take. And then students can be completing some of the courses in psychopharmacology while they're finishing their doctorate degree. And then when they obtain their doctoral degree and become practicing psychologists, now they have this additional body of knowledge about psychoactive substances, which of course includes medications, and have a better understanding of how to work with patients and clients who actually may be on some of those psychotropic medications. And then the final level would be for psychologists who have completed their training and now are practicing psychologists who want to go the extra step and become a prescribing psychologist. 7 states currently permit psychologists to do so, and they all have somewhat different requirements, but they all require this degree, the MS in Clinical Psychopharmacology, of which there are now 6 across the U.S. We are one of them. APA designated program. And then after completing that degree and some additional practical components, students would be then eligible to become a prescribing psychologist.
This episode was made possible through a Psychi sponsorship with the Alliant International University, California School of Professional Psychology. That's CSPP. Founded in 1969, CSPP was one of the nation's first independent schools of professional psychology. Today, CSPP continues its commitment to preparing the next generation of mental health professionals and advocates. Their dedication to ensuring every community's access to quality mental health care extends from integrated care to inclusive family therapy. Explore their programs at https://info.alliant.edu/partner-psychi. And of course, I'll put a link in the show notes for that as well. Let's say a student is listening and they're interested in, learning more or getting involved. Do you have any steps for them to get started or like choose a program, things like that?
I think there are a couple of important factors. So I think students need to decide when they want to begin the training, if they want to begin the training concurrently with their doctoral program. Only some of the MS in clinical psychopharmacology programs permit graduate students. We are one of them. I believe there's 2 others currently who do so. So that would be one thing to look at. The other thing to look at would be the type of education that the program delivers. These are all online programs, meaning you don't have to attend in-person classes. However, some programs like ours rely on live education via video, for example, being on Zoom, where you have a live instructor lecturing, taking questions, clarifying, explaining. So for medically complex information, we feel that this is the beneficial model, or that this model is just makes it easier for students to grasp this kind of information. There are other MS in clinical psychopharm training programs which rely entirely on distant education, meaning they're all asynchronous classes. Which means that everybody completes their assignments and views lectures at their own pace, but also means that you don't have quite as much interaction with the professor.
What are some tangible benefits, either clinical or financial, that psychologists and graduate students could expect to gain in psychopharmacology?
I think the benefits are very significant. So I think we need to look at the trajectory of mental health professions, period, and how many of them there are now in the first place. And then what kinds of services they can deliver, right? So, practicing psychologists now have a lot of competition from master's level professionals, from mental health counselors, from clinical social workers, who not only perform psychotherapy pretty much at the same level that psychologists do, and in some cases actually receive the same reimbursement from insurance companies, right? And in some states, they have even allowed master's level practitioners to do some psychological evaluation, something that really used to be the exclusive realm of psychologists. So as these other mental health professions really are kind of taking over a lot of what we do as psychologists, I think psychology needs to go the next step and expand our toolbox by additional dimensions, by additional tools, more information that these master level professionals don't know, don't practice, right? And I think psychopharmacology is an excellent area where psychologists who, in addition to being psychologists, obtain this training in psychopharmacology, even if they don't go all the way to become prescribing psychologists, maybe they practice in states where that is not permitted. Nevertheless, obtaining this additional training gives you an extra set of tools and opens other areas of practice. For example, consulting with prescribers, which sometimes may be psychiatrists, but even more commonly, these prescribers are primary care practitioners, because in the US, depending on the age group, anywhere between 2/3 to 3/4 or more of all psychotropic medications are actually prescribed in primary care because there just isn't enough psychiatrists. And primary care practitioners really look forward to collaborating with those mental health professionals who have significant training in psychopharmacology and can help them A, select a psychotropic medication, B, monitor after a prescription is written how they're responding to the medication, and C, probably most importantly, look out for side effects, right? And then give feedback to the prescriber if side effects are present. So this is really an area where psychologists can expand their practice still as psychologists by adding this additional set of important tools.
I hesitated to ask this next question at all, but given how it's been kind of floating around the media lately, it felt kind of weird to just avoid it. So I wanted to ask, some people, they question the role of medications in potentially violent behavior. Is there any evidence that commonly prescribed medications could cause harmful behavior to oneself or others? And if so, how could that be avoided?
There are various dimensions of this that are important to kind of consider separately. When you look at how psychoactive substances affect violence potential for a person, specifically being violent towards others, the vast majority of information suggests that in general, the use of psychotropic medications tends to decrease the likelihood of violence. What we need to understand is that there will always be exceptions, right? And it's not just psychotropic medications. I mean, most violence, most spousal abuse, even most suicides actually occur under the influence of alcohol, right? So there may be, and there are, individuals for whom psychotropic substances can be unpredictable and disinhibiting. And then for those people, they can potentially, in addition to other factors, maybe contribute to violent behavior. But we need to understand that when you look at it population-wise, the vast majority of people who may have violent tendencies, if the medication that is prescribed is an appropriate medication for them, the violence risk is much more likely to decrease rather than increase. Now, the one exception to what I said that needs to be acknowledged and thought about is antidepressant medications. So especially among teenagers and younger adults, there is some data that suggests that prescribing an antidepressant can initially increase the person's suicidality. It's a complex area. First of all, not everybody agrees, but there is some data that may suggest that. It's kind of important. And again, obtaining training in psychopharmacology, someone would now understand the mechanisms of that better, right? And how to work with someone to maybe prevent that kind of harm. So briefly, what can be said about that is it, first of all, occurs primarily in the first couple of weeks of treatment, because the effects of antidepressants can be somewhat activating before the actual antidepressant effect sets in. So for individuals who may have already harbored deep thoughts, maybe even plans, about harming themselves, but perhaps were just too depressed with regard to their energy to act on it. All of a sudden, they take an agent that's going to activate them a little bit, and now they may be more likely to actually act on some of these thoughts, right? So as another piece of information here, another important variable that should be also recognized is while we talk about potential for increased suicidality in a small percentage of patients going on antidepressants, there also have been actually no completed suicides associated with starting an antidepressant. So we're primarily talking about the fact that a small proportion of population, when first described an antidepressant, may have greater suicidal thoughts, may begin to maybe actually plan to take some suicidal action. The way to address that is to increase monitoring and make sure that in addition to a prescription for an antidepressant, a person is also in other type of mental health care, for example, in psychotherapy, right? Where then the practicing psychologist, especially the psychologist, understands that for the first few weeks, there may be a small additional risk for suicidality. The psychologist can work with the person more closely and screen for that, right? So this is again where the knowledge of psychopharmacology can really inform clinical practice by psychologists.
I'm curious, like the follow-up procedure when someone is prescribed a new drug, what should that look like, or what does that look like? How frequently should people go in? What should they expect?
Well, what that looks like depends on where that patient or client is getting that prescription. So as I mentioned before, the vast majority of psychotropics in the US are prescribed by primary care practitioners. Primary care practitioners, given their patient load, right? It's not unusual for primary care practitioners to have 4,000 active patients in their practice that they need to see at least annually, right? That's a huge number of patients that they are responsible for. Their ability to do regular and in-depth follow-up after writing a prescription for psychotropic medication is really limited due to these practical considerations. So if a psychologist with a knowledge in psychopharmacology is involved and perhaps collaborating with that physician on treating that particular patient, then that follow-up can occur quicker. Because what we really want, especially for antidepressants, right, which is a good example, that they may increase suicidality for some patients, right? So you write a prescription for an antidepressant, and if the patient starts taking it right away, you really want to have a session within a week or two to screen that patient, to talk to that patient more in depth. What is that experience like for them being on this medication? Has it affected suicidality in any way? Has it changed their level of energy, right? Has it maybe caused some agitation? Has it maybe caused some sedation? Patients' reactions, of course, vary. So ideally, you want that patient seen within a week to 2 weeks to see how they're responding to this medication. It's just that most prescribers don't have the means to be able to do so. And that's why so many patients are written prescriptions and they're not followed up with for several months.
As a program director, how do you recommend graduate programs approach psychopharmacology education to ensure students are both competent and confident?
There are standards issued by the American Psychological Associations specifically for graduate programs in psychopharmacology. Those programs which meet those standards are then, quote unquote, designated by APA as a training program in psychopharmacology. So I think, again, there's a couple of levels that come to mind here. On the undergraduate level and undergraduate doctorate level, I think it is really beneficial for programs to have content in psychopharmacology, perhaps on a doctoral level, a course for doctoral students in psychopharmacology. which would then speak to gaining a broader understanding of psychotropic agents, in general, and having a better understanding of how patients may be affected by using substances or being prescribed a medication when those patients come into psychological treatment. But then if someone wants to go further and obtain the actual Master of Science in Psychopharmacology, the best recommendation I would have is to seek a program that is accredited, or I should say designated by APA, because those programs would have the highest standards.
Looking ahead, how do you envision the role of psychologists evolving as psychopharmacology becomes more integrated into psychological practice?
So I think it again will occur in different ways in different settings, but I think the bottom line is, given the trends in the American population towards using psychotropic medications, I think the need to have psychologists obtain more background in psychopharmacology is really inevitable. It is really urgent, it's already there. Data suggests that about 1 in 6 adults in the United States at some point in their life are treated with a psychotropic medication. That's an incredibly high percentage, right? Given some factors that we have working in the US, some of it is insurance coverage, which tends to prefer treatment with psychopharmacology as opposed to psychotherapy, because simply speaking from their point of view, it's cheaper. Also, we live in a country, one of only 2 countries in the world that actually permits direct-to-consumer advertiser of prescription medications, which I think contributes to the population kind of looking at medications as something that probably is going to help me. So these trends in terms of the number of the percentage of population that is being prescribed psychotropic medications, they will only increase. So to keep up, to be competitive, and to be able to appropriately service and now a population that is far more likely to be on psychotropic medications, psychologists really need to obtain this background. And in recognition of that, psychopharmacology now is actually a recognized specialty within psychology, because we recognize that just like substance abuse, for example, is a recognized specialty. Now, psychopharmacology is a recognized specialty because it is relevant now to such a large portion of the American population.
Well, I just want to thank you so much for your time and for sharing these insightful answers with us. About your expertise, and your really thoughtful responses have been very useful to me. So yeah, just thank you so much.
Thank you for having me. I really appreciate it.
Thanks for listening to another episode of Psych Everywhere. If you haven't already subscribed to Psych Everywhere, go ahead and follow us wherever you go for podcasts. Tell a friend or a colleague about the show. Word of mouth is a huge help, so share what you learned at the dinner table or in your classes. You can also follow us on X at Psychi Podcast and leave a review at Apple Podcasts. You'll absolutely make my day, and more importantly, you'll be helping us to get Psych everywhere. Okay, that's all for now. I'll connect with you again soon. Copyright 2025, Psychi, the International Honor Society in Psychology. All rights reserved. Did you know that Psychi is also seeking to increase its support for future generations of mental health advocates? We're currently raising funds for the Christian Ladd Hall Scholarship for Mental Health Advocacy. Christian Ladd Hall was a young man whose life was impacted by bipolar disorder 2. To honor Christian, this scholarship will annually support one undergraduate or graduate student seeking a career in mental health advocacy. Once fully endowed, a yearly recipient will receive $3,000 and can request an additional $1,000 to create and offer a mental health event in their community. To learn more or donate to this scholarship, please visit the link in the show notes.